Hi, my name is Jamie Turpin, and I am the Prescription Drug Monitoring Program Administrator for the Arkansas Department of Health. The Arkansas PDMP is housed in the Department of Health inside the Substance Misuse and Injury Prevention branch. Within this branch, there are 3 sections. The first section is the Substance Misuse and Injury Prevention section. Within this section, we have our Dose of Reality campaign. It is an educational opportunity for individuals ages 12 to 25 on how to take medications, what questions to ask your physicians, how to properly dispose of medications, and how to store medications. We also have our Narcan training for first responders. Our educator will go out to volunteer firefighters, crisis centers, and shelters, training them on how to use Narcan nasal spray. And at the end of the training, they will receive 1 dose of Narcan at no charge to take with them. Another section within our branch is the Injury and Violence Prevention section. Within this section, there is the Suicide Prevention Education, as well as the Arkansas Prevention Suicide Lifeline. The Suicide Lifeline is the first suicide hotline that is actually within a state entity. There's also the Arkansas Violent Death Reporting System, Violence Prevention and Rape Education, Motor Vehicle Crash Prevention and Accidental Poisonings. And the third section within our branch is the Prescription Drug Monitoring Program. In 2011, Act 304 passed and it was enacted into law. This act mandated that the Arkansas Department of Health establish a prescription drug monitoring program. It took 2 years, but in March of 2013, the Arkansas Department of Health was ready to go live with their Arkansas Prescription Drug Monitoring Program with the purpose to enhance patient care, help curtail the misuse and abuse of controlled substances, assist in combating illegal trade and diversion of controlled substances, and to enable access of prescription information by authorized individuals. So what is a Prescription Drug Monitoring Program, or PDMP? The PDNP is a program that keeps the records of all dispenser transactions of controlled substances. What is a dispenser? A dispenser is a practitioner who dispenses prescriptions, such as pharmacies, veterinary clinics, or physician's office that dispense medications. What is the frequency this is reported to the PDMP? It is next business day reporting for pharmacies and every 30 days for veterinary clinics. What are controlled substances? These would be Schedule 2 through 5 medications that are reported. For opioids, that would be like hydrocodone, oxycodone, morphine. Benzodiazepines, such as Xanax, Klonopin. Stimulants, such as Adderall and Ritalin. And other controlled substances, such as testosterone, some muscle relaxers, and hypnotics, etc. So who has access to the Prescription Drug Monitoring Program? With the initial mandate, prescribers and pharmacists. Prescribers would be your physicians, physician's assistants, nurse practitioners, dentists, etc. Pharmacists, and in 2015, their delegates were added. So somebody that a prescriber or a pharmacist would like for them to check the PDMP under their authority, they can delegate that to someone within their office or their pharmacy. What kind of reports can prescribers and pharmacists see? Patient reports. And for prescribers only, they can do a MyRx report. A MyRx report is when a provider can look up all the controlled substances dispensed under their individual DEA number. Licensing boards. Licensing boards have access only for investigations of their licensees. Law enforcement. In the original mandate, it was pursuant to a search warrant. However, in 2015, legislation passed to allow certified law enforcement prescription drug diversion investigators access. This is a specialized group of law enforcement that have gone through a training and passed an exam to allow them to check the PDMP pursuant to an active case. An annual audit is done on these searches to make sure they were appropriate. In 2017, access was granted to Medicaid, specifically the pharmacy side of Medicaid. And then in 2019, the Office of Medicaid Inspector General was granted access to the PDMP in searching for fraud, waste, and abuse of our Medicaid system. Here's a snapshot of what the users of the PDMP accounts look like as of March 5th, 2021. The Arkansas PDMP had over 25,000 users. Our top 3 user categories are delegates, physicians, and pharmacists. Some newly added roles starting December of 2020 would be the VA prescriber, VA dispenser, and the VA prescriber delegates. So providers in the state of Arkansas can have access through an account, but we also share data with 37 other states. You can see those states highlighted in red. We also share PDMP data with Puerto Rico and the military health system. The military health system is specific to prescriptions dispensed on base, and that is both on base stateside as well as on base outside of the state's borders. So when do you have to use the PDMP? Act 820 of 2017 was passed, and in the summer of 2017 mandated that providers shall check the PDMP prior to prescribing in 2 instances. One is a Schedule 2 or 3 opioid every time they write this prescription for a patient, a benzodiazepine for the first time this is written for a patient, with some exceptions. For patients that are inpatient in a hospital and the medication is administered on site, for a hospice patient, nursing home patient, and an emergent situation, specifically with EMS on an ambulance or an air ambulance. A healthcare provider must document that in the patient record that the Arkansas PDMP was checked. So now that you know about what the PDMP is and who has access, at the Department of Health, we like to analyze our data, as well as other entities analyzing the data. As you can see, here is a map of the United States. Highlighted in red and orange are the highest states for the opioid prescribing. So to put this into perspective, in 2019, the CDC analyzed that Arkansas had an 80.9 opioid prescription per 100 rate compared to 2018's 93.5 prescription per 100 people rate. So in essence, Arkansas's opioid prescribing has gone down, but we are still the number 2 state in the nation for our opioid prescribing. The overall U.S. average rate is 46.7 prescriptions per 100 people. Arkansas is almost double the national average in our opioid prescribing. This is a graph that shows 3 different lines. They're all showing the opioid prescriptions per 100 people. If you look at the orange line on the top, that is the Arkansas PDMP dispensing rate. This rate is analyzed here at the Department of Health with our PDMP data. It is specific to Arkansas patients and Arkansas providers, and it encompasses all the dispensations sent to us. The blue line and the gray line are CDC rates that have been determined on their own analysis. They utilize what I would like to call a snapshot of the number of prescriptions dispensed. They don't encompass mail order prescriptions, and it's not all the pharmacies in the state. It's about 92% of the pharmacies in the nation that they get this data from. You can look from left to right that from 2015 to 2020, all the lines decrease. The orange line, which is the line that is the Arkansas PDMP rate, starts with 117.7 opioid prescriptions per 100 people in 2015 and decreases all the way through 2020 to 86.3 opioid prescriptions per 100 people. You can see that the gray line, which is the national average that the CDC analyzes, is significantly lower than what the Arkansas rate is. This slide shows a heat map by county of the opioid prescription rate per 100 people. This is specific to patient address. This does not indicate the dispenser address or where the provider was located. This is where the patient is located. Looking at this map, you can see that the lighter red are the states with the lower rate, and the darker red are the states with the higher rates. Looking at this map, you can see that there is not one area that is really a hot spot. It is dispersed throughout the state of Arkansas. Some of our highest rated counties would be Poinsett at 151.5 prescriptions per 100 people, Montgomery, Greene, and Ouachita. I will note that from 2019 to 2020, all these counties have decreased their rates. Some of our lowest counties will be Miller County, at 34.5 opioid prescriptions per 100 people, Benton County, and Washington County. This map is only for Arkansas providers, and we have excluded buprenorphine in this analysis. This slide shows the number of opioid prescriptions and number of opioid pills dispensed from 2018 to 2020. If you look at the 2018 number of opioid prescriptions dispensed, it was about 3.28 million prescriptions. Jumping forward to 2020, we have decreased our number of opioid prescriptions dispensed to 2.6 million. This is almost a 21% decrease in opioid prescriptions. In 2018, looking at individual dosage units of opioid pills, we went from 186 million pills down to, in 2020, 141 million pills. This is a decrease of 24%. These are prescriptions specifically written by Arkansas prescribers, filled by Arkansas residents. This table breaks down the opioid prescription counts by generic drug. Hydrocodone, tramadol, oxycodone, codeine, and morphine have been our top 5 opioid ingredient prescriptions. If you look in 2018, hydrocodone was 1.37 million prescriptions. In 2020, it decreases to just a little over 1 million prescriptions. This is a decrease of 21%. Hydrocodone, tramadol, oxycodone, codeine, and morphine have all decreased in number of prescription counts from 2018 to 2020. One to note is oxycodone. Oxycodone in 2018 was 534,000 prescriptions. That decreased in 2020 to 367,000 prescriptions. This is a 31% decrease in the number of oxycodone prescriptions dispensed in the state of Arkansas, written by Arkansas providers, filled by Arkansas residents. This next graph depicts individuals that have gone to multiple providers and multiple dispensers for controlled substances. The threshold for this graph is a patient that went to 5 different prescribers. That can be a physician, nurse practitioner, physician's assistant, dentist, 5 different dispensers, that would be 5 different pharmacies within that 90-day period or that quarter. In quarter 1 of 2017, we identified 300 individuals that met this threshold. As you jump forward to the end of 2020, we're averaging about between 45 to 53 individuals that have been identified meeting this threshold. Another term for this would be considered doctor shopping, a patient going to multiple providers and multiple dispensers for the same or similar medication. So, in essence, doctor shopping has decreased in the state of Arkansas. This heat map depicts the overdose death rates per 100,000 people per county in 2020. I want to note that the death certificate data that we get is typically a little delayed, waiting on death certificates to be finalized. So this data here is provisional at this time. Looking at this map, the darker red is the higher rates and the lighter red or white are the lower rates for overdose fatalities. In 2019, there were 362 overdoses identified, fatal overdoses identified. In 2020, we are at 401 as of February of 2021 when this analysis was done. This number may increase over time. But you can see that from 2019 to 2020, we had more overdoses in 2020 than 2019. The overdose fatalities have increased. Some of the top rated counties on this list are Lee County, Woodruff County, and Lawrence County. If you have any questions on any of the analysis that have been performed, you can contact me, Jamie Turpin, at the Department of Health, or you can go to our website at healthy.arkansas.gov, go to the PDMP webpage, and we have many more analysis like these. Thank you.